Good evening and welcome to all my dears. I am Dr. Karamchand. It is reported that a study conducted by the Cardiology Department of Sri Chitra Institute among cardiology patients below 30 years of age found that 64% were smokers and 21% were habituated to alcohol. The most worrying factor is that 48% who had heart attacks below 30 years of age are dying in the next 20 years. Only 4.4% did not have any of the major potentially modifiable risk factors at presentation. That is, smoking, systemic hypertension, diabetes mellitus, dyslipidemia, alcohol abuse, or obesity. The study also found that 34% of the smokers who had heart attacks started smoking again, and 26% started consuming alcohol again also. A majority of them were physically inactive. The team of doctors identified that potentially modifiable risk factors including smoking, high blood cholesterol, hypertension, alcohol abuse, obesity and diabetes mellitus account for 95% of the symptomatic coronary artery disease in people below 30 years of life. The vast majority of the patients were males, near about 92%. 64% of patients with symptomatic coronary artery disease in the age group were smokers and 88% had high blood cholesterol also. The seriousness of the issue is that among those below 30 years of age who have been identified with cardiac problems, 48% of them are dying in the next 20 years. The main reason is that they are either not taking medicine or having periodic review or continue to have the risk factors since they restart smoking and drinking. It is found that 41% of the patients were non-compliant to medication. Absence of symptoms was the most common cited reason for discontinuation of the medicines. While nearly half of the medically managed patients had discontinued medicines, non-adherence was less than 1/3 in those who had underwent angioplasty. Doctors also stated that 10-year mortality of 30% and 48% at 20-year follow-up is a serious cause of concern in patients below 30 years of life. The interesting fact is that the study was conducted on patients who took treatment at the institute from January 1978 to December 2017. The study group comprised of 159 patients. The youngest patient was a 10-year-old and the youngest who underwent bypass was a 15-year-old.